If you've ever been told that your bloating is just normal, or you've cycled through probiotics hoping that they'd fix everything, this episode is going to change how you think about your gut and your health entirely. Hello, and welcome back to The Other Way, where we explore alternative paths in health, well-being, spirituality, career, and life. I'm your host, Kasha, and today I am joined by functional gut health practitioner and host of the Nutrient Dense podcast, Hannah Aylward. We go deep into digestive health and beyond it. You've probably heard the phrase gut health everywhere, but what does it actually mean? And how does it connect to things like endometriosis, PCOS, anxiety, and even burnout? In this conversation, Hannah unpacks what's really happening beyond the surface. From the impact of antibiotics, why probiotics aren't the whole answer, and how nervous system dysregulation and immune dysfunction show up as gut symptoms. If you're someone who's tried the elimination diets, the supplements, and the clean eating plans, and you still feel like something's off, this episode is your permission slip to go deeper and start healing at the root. Let's dive in. Hey, Hannah, welcome to The Other Way.
Thank you so much for having me.
I'm so pumped to get to chat with you. I know that a lot of women deal with digestive issues, bloating, even hormonal imbalances and the connection that may have to the gut. So we'll dive into all of those things. But before we do, I would love for you to share 3 words that you would use to describe yourself.
Oh my gosh, that's such a nice question. Resilient would be number one. Maybe that's a trauma response. Resilient, consistent, I would say, and positive.
I love that. In the brief conversation that we've had so far before this interview, I feel like all those definitely resonate with the vibe you're putting out. Okay, so you have a really interesting background because you are an expert in gut health and in nutrition, and you cover a lot of different topics. But before we dive into some of those, I would love for you to share your background. How did you get into nutrition? Is there a personal story there that really inspired you to focus on this as opposed to all the myriad of other health areas? Tell us.
Yes, definitely. And I think that's the way for so many of us that kind of find this work. But for me, I was really struggling with chronic digestive issues for years and years. And I was kind of like the healthy friend. So I was like into healthy eating. I was before it kind of got cool, right? And like trendy and on social media, before we were even like posting things on social media, I was like really into nutrition. And it really initially started from like a negative lens, being like, I want to be skinny. I really want to control the size of my body. And then it really was negative and then kind of morphed into something positive. But through that experience and like the restrictive dieting and the under eating and the over exercising, coupled with a couple other things, I developed a lot of really bad chronic digestive issues. And we'll see that a lot in clients, right? Like just history of restriction, heavy restriction doesn't do the body super well. So I'm eating all this really healthy food. I don't eat gluten. I don't eat dairy. I don't eat sugar. I barely drink alcohol. Like I'm drinking like a glass of organic wine with my girlfriends. And what's going on? Because I look 6 months pregnant with bloating and it was like burping. It would mess with my sleep. At one point, like I lost my period for 2 years and I was like dealing with, it's really not fun. So I feel for the women that are going through that. And things just got kind of worse. And then it got to the point where it was like, it doesn't really matter what I eat. Like I could eat a French fry and look 6 months pregnant, or I could eat like an apple and look 6 months pregnant with bloating. So it was very confusing because I'm like, I'm doing all the quote unquote right things. I'm active, I'm exercising, I'm trying to prioritize sleep. I was like low toxin. I mean, I was using like clean beauty products like from day one, right? So it was not equating. Like I was like, I'm eating this organic, healthy food. What's going on? And I was young and I don't have like genetic predispositions or anything. So it was just like, this is so weird. And very oftentimes when women go through this process, you're told, just relax, just relax. And
So, what I want to do in this situation, that's very helpful.
yes, exactly. Or just you're just stressed. So then I start kind of running the story of, oh my gosh, maybe I am just like, I'm just so stressed. I'm just like traumatized. And it's like the ebbs and flows of the whole journey. But long story short, I just started digging a lot deeper because I was like, something is off. And even though everyone else is telling me I'm okay and no one really knows what to do with me, I think I should feel better than this. Right. And then I really dove into the gut health research and a bit more about all that, and understanding that our gut environment plays such a large role in how we respond to foods and assimilate nutrients and absorb our nutrients. And it's not just what you eat, even though of course what you eat like deeply impacts your gut health and gut function and overall health. But it's like we have this whole gut environment element to things where if things are kind of out of whack there, we're going to be flaring. Skin could be flaring, energy could be low, thyroid could be sluggish, and then of course like the bloating and all of that. So that's how I got into all of it today. And then I really just started coaching people and helping people. And then I really built out my team. So now it's like I've got a team of, I believe four. There's four functional practitioners, registered dietitians, clinical nutritionists, and we really help women all over overcome their chronic digestive issues by just digging deeper, understanding what's going on underneath the surface that's causing this bloating, or that's causing the constipation, or that's causing the chronic acne that won't go away, instead of just kind of slapping a band-aid on it.
That's so powerful, really thinking about like the root cause and getting down to what's really contributing to some of the symptoms as opposed to just treating the symptoms themselves. I feel like there might be some misconceptions for folks. When you say gut environment, what are you referring to? Is it your gut microbiome, or does it actually have a lot more bound into that environment component?
Yes. Yeah. I say that and I recognize that not everyone says that. So let me break it down. It's yes, your gut microbiome. Absolutely. So your gut microbiome is like the trillions of microorganisms within your gut. When we say that, most people are referring to the large intestine or the colon. We do have microorganisms in the small intestine and the stomach as well. Those would just be digestive organs overall. So I'm kind of talking like digestive organs overall, because if we have an infection in the stomach, that can cause issues. If we have overgrowth of bacteria in the small intestine, that can cause like loads and loads of bloating and food reactions. And then also the large intestine, we can have imbalances there too. And then I'm also kind of referring to like our digestive capacity, or how we can actually break down our food. I think that topic and conversation is like largely missed because a lot of people go to like probiotics and they go to gut bacteria, but we have to understand that digestion is like a north to south process and it starts in the brain. So our nervous system is what's really regulating the digestive process. And then with the mouth, right? And then it goes down the esophagus and into the stomach. And any like kink in the hose or like piece out of place in that whole digestion chain can cause issues. So it could be low stomach acid, it could be poor bile flow, it could be poor pancreatic enzyme secretion. It could also be like nervous system dysregulation. And so it's really like a kind of a top down approach we want to really take when we're looking to get someone better. So when I say gut environment, everything that's going on in the digestive process, essentially.
So you alluded to this a bit actually a second ago. Immediately I was going to be like, all right, gut environment, microbiome,
Mhm.
seed probiotics, right? Which is the one that I see everywhere.
Yeah.
But it sounds like probiotics, although they're an important part of the picture, they're not the whole picture. I would love for you to share when you're thinking about the things that influence our gut. You talked about how it is a north to south process and that our brain really has an influence on what's happening. When you say our brain, is it just the physiological processes in our brain, like if things are underperforming or whatever? Or is it also like our environment and our mental state, or
Mhm.
even what we're doing while we're eating or after we're eating? Can you talk a bit about what that means in terms of the brain environment or the brain process also impacting the digestive process?
Yeah, totally. So we have a pretty strong gut brain connection and it's bi-directional. So our gut will influence our brain and our brain will influence our gut. The easiest way for people to probably understand this is going to be like your nervous system. So if you are in a stressed out state, or you're entering that like sympathetic dominant nervous system state, or that fight or flight state, right? In this state, digestion is really an afterthought. The opposite of that state is going to be the parasympathetic, or the literally we call it like rest and digest. That's when you digest your food. So if you are someone that's operating at a high level of stress, and sometimes clients don't resonate with that, so I have to ask them like, how often do you feel overwhelmed? Because that's a reflection of stress, right? Because so many women are so high functioning and they're managing kids and work and picking up the dinner and all the things at once that it's like we're just used to it and we're like, oh, it's fine. I actually don't feel that stressed. But then so sometimes like asking, oh, are you feeling overwhelmed and how frequently do you feel overwhelmed, can hit a little like deeper, or they can access that. So if you're really operating in that state, that's going to negatively impact digestion. So when we enter that sympathetic dominant state, gut motility is going to slow down. The blood flow is going to go away from the GI tract. You're going to produce less stomach acid. You're going to produce fewer pancreatic enzymes. Your gastric capacity will be impacted as well. So we will literally see chronic stress cause gut issues. So like whenever I'm teaching, I always bring up this diagram that I have that breaks it all down so you can see like literally how it goes from mental stress to fungal overgrowth, right? So I say like stress doesn't stay stress, it becomes actual physiological issues. And that can be hormone imbalances, that can be gut issues, things like bloating or IBS or food sensitivities as well. But essentially, like when you're in that stressed out state, your body's not prioritizing digestion. It's prioritizing like, everyone says running from the tiger or whatever. But in modern day, we're usually not running from the tiger. We're like trying to manage our inbox full of emails and the to-do list is growing. And then, oh my gosh, I haven't done this. And then on top of that, we try to get in the workout when we really aren't, we're under resourced as is. And that's where most people are living. And then you add in technology and social media and all the things, and that's really revving us up too. So over time, that will really contribute to poor gut function.
I think you're calling out something very important because, as you mentioned, like a lot of people don't even recognize that they're stressed. They're just like high functioning in their lives. But it's so true. I mean, between even just topic toggling, right? Going from inbox to picking up the phone to checking Instagram, like we never have a moment of peace to have that like restful digestion process, I think, by and large in
Mhm.
society. So I think it is such a valuable insight to really reframe how we talk about stress because we might not even realize that it's happening. I'm curious, what are some of the symptoms that women or any of your clients come in with? And also, what are some of the diagnoses that you see? Because a lot of people, A, may not realize that a symptom is actually a digestive symptom. And B, a lot of people may not realize how certain conditions actually have a digestive component. So could you first talk about some of the most common symptoms you see? And then also, what are some of the conditions that people come in with if they have been diagnosed?
Yeah, absolutely. So we see a lot of chronic digestive issues, I would say. So like bloating, and not your bloating where it's like Friday and you go out for a couple pieces of pizza and have a few beers and you feel a little bloated and you wake up and you're fine. That I would say is like more so normal. The clients that we see will wake up bloated without even eating. They'll look 6 months pregnant with bloating by the end of the day. It's interfering with their lives. They're canceling plans. They feel like they have to unbutton their pants. They may be dealing with constipation or diarrhea. So like some clients are running to the bathroom 8 times a day. Some clients go once every week, and neither of those is good. They have their own issues. They can have similar root causes actually, but so we see a lot of that. We'll see a lot of food sensitivities and reactions. So people that have to kind of try to micromanage what they eat because they can't tolerate a lot, thinking that when we just peel out a lot of foods, that's quote unquote healing the gut, when usually it isn't. There's kind of more going on. A healthy, resilient gut microbiome can tolerate most foods. Now, with that being said, yes, if you go out and have 4 glasses of wine, no one's going to feel good after that. But if you feel like you're like, oh, I can't eat onions and then I can't eat garlic and then I can't eat any dairy and then now I can't eat this fruit and now I can't eat, there's something else going on, right? So that's a sign of kind of like gut dysfunction. So we see a lot of food sensitivities and reactions, food intolerances that they have overlap. I don't really care what you call them. You're just reacting to food, right? You feel like you have to live on restriction. We'll see like chronic low energy. We'll see really painful periods. We'll see trying to think of what we see the most. Skin. So we have an entire skin program. I have a skin expert on my team who's done some pretty extensive training, and it's all about the gut skin connection. So we'll see like acne, eczema, psoriasis, and then we'll see sluggish thyroid function, hypothyroidism, or Hashimoto's. We'll see some endometriosis. So we do see it all because the gut is really the center of so many different kind of disease states. So when we're looking at taking a root cause approach, whether it is Hashimoto's or it's acne, we're always going to look at the gut, or it's IBS. A lot of women, have been told they have IBS. We see probably like 70% of our clients have been told that. And they've gone for the colonoscopy and they've gone for the maybe endoscopy and they've gone for the blood work and everything looks normal. So then you're just kind of told you have IBS because you can't digest anything and you're feeling bad digestive system wise. And that's really where we come in to dig a bit deeper. So your gut is really, I mean, there's so many different mechanisms through which it influences like your entire body. But essentially, if you have a lot of gut dysbiosis or imbalance of your gut bacteria, that's going to then cause degradation of your gut barrier, your gut lining. People sometimes are familiar with like leaky gut, right? And then that can more so trigger this like systemic inflammation that can pop up as acne, it can pop up as joint pain, it can pop up as a few different things. And the other thing that I think just is easy for people to kind of conceptualize is that's where your gut's where you absorb all the nutrients from the food that you're eating. So if you can't absorb the nutrients from the food that you're eating efficiently, everything's going to take it from there, right? Fertility, hair growth, skin, thyroid function. I mean, it doesn't really matter even if you're supplementing and you can't absorb it, which we see a lot of clients with, that's going to cause kind of lots of different issues. So it's, to me and our kind of lens, it does matter how it expresses, but it's a bit less about like how it's actually expressing and more at like what's at the core of this.
I think that's such an important call out that even though supplementation can be helpful, it's like it's almost as though you're in a boat, right? And there's a hole
Mhm.
somewhere, right? It's coming out and you're not absorbing it because I don't know, you have chronic diarrhea or you have a leaky gut or whatever it is, right? Or it's just kind of recirculating as a toxin, but it's not getting absorbed into your system. And I think that it's such an important call out that even though supplementation is helpful, if you're not actually absorbing your nutrients because something's wrong, whatever the root cause of that is, you are going to suffer. Like every aspect of your physiology is going to suffer. Before we dive into some more of the details around gut dysbiosis, leaky gut, kind of the brain gut connection, I would love for you to ground the audience in what does healthy digestion look like? What can we aspire to in order to have some of the listeners be able to reflect on, whoa, something's actually out of whack, or these might be early signs of something being out of whack?
Yes, and we would love to catch it early. Let's catch it early. Usually we're like the last stop on the train for people and I'm like, "Oh, I wish we could catch them like 5 years sooner." But yeah, essentially like we're looking at daily bowel movements. So having 1 to 3 each day. 3 may sound like a lot for some people. I wouldn't say you need to have 3. It's you'll find your own rhythm, but we definitely want you moving your bowels every day. So at least once a day. They shouldn't be loose, they shouldn't be floating. They should be like look like kind of like a snake, I guess, a snake in a bowl. You shouldn't feel really tired after you eat either. Like you should feel like food gives you a bit of energy, a little bit of, ooh, I can feel my body digesting the food is one thing. But if you eat and then you're like, oh my gosh, there's a brick in my stomach or I'm exhausted, it should help give you a bit more energy. You shouldn't feel bloated to the point where you have to unbutton your pants. So you should eat. Yes, your like stomach will expand a little bit as we like put things into it, right? So you don't necessarily need to look the exact same way after you eat as you do right before. You're adding volume. That makes sense. But if you have like lots of gas or bloating, or you feel like it's distended and you could like almost put a pin in your stomach, right? That's kind of the bigger issue. So you should eat, you should have energy, you should be using the bathroom regularly. You should be able to tolerate many different foods. You shouldn't have too many foods on the no list. You obviously want to maintain a good healthy diet as like a baseline, but I don't want anyone, you should be able to eat freely. Go out for date night and have a bite of what you want and just resume your life after that. Not necessarily pay for it for 3 days afterwards. Those are some of the biggest things that would be indicative of, yeah, just healthy digestion, kind of digestion you don't really think about. Like it's not really bringing up anything in your life. You're just, your body's doing it and then you're moving on.
What about mental symptoms? Because I've heard about there being like the gut brain connection, anxiety, depression, right? I mean, I've read a lot of literature talking about the root of anxiety actually stemming from the gut in many ways. Can you talk about that a bit?
Yeah, and there's so many different kind of ways that this can happen too. But essentially like most of your serotonin is produced in your gut. If we have a microbial imbalance that's impacting our serotonin production, that is kind of, people will call it like one of those happy chemicals, right? That can influence things like anxiety and depression. There's also some research that shows other strains of gut bacteria can essentially increase levels of stress hormones in the body. So they can increase like epinephrine. So that'll make someone feel panicky. That will make someone feel like that. And then the other thing that I would loop in, and once again, like I could take this in so many different places because it's like, it's all so much is stemming from the gut. But the other big one that we'll see is like histamine. People will say histamine intolerance. It's a bit more of an overload situation where your bucket's kind of overflowing and we have to figure out why. But if you have signs of like histamine overload, which would be bloating, diarrhea, itchy skin, rashes, lots of like nasal congestion, headaches. We'll see it pretty consistently with like headaches, migraines, but it can also cause and trigger things like heart palpitations and kind of like panicky feelings. So, in a lot of clients that we'll see, like they'll have a lot of like histamine overload, and that can be largely stemming from the gut. So, once we can kind of clean that up, we can also see people just start to feel better in a myriad of ways. And then we really take a root cause approach. So we're also looking at like blood sugar balance and nutrient deficiencies. And if you're dealing with anxiety, balancing your blood sugar is like the absolute first thing that you should do. It's like pretty simple once you learn how. And anytime our blood sugar drops really low, the body's going to kick out cortisol to raise that blood sugar, that blood glucose level. This is kind of going into more of the hormone track, but it's all connected. Like no system is existing completely disconnected from another. So we always work on like adrenal support and blood sugar regulation with our clients too. So when you get that drop and then the body kicks out cortisol, that stress hormone, I mean, that can make you feel anxious as well. So my sister, I'm very close to my sister, and she's had a whole story with anxiety. It used to be very bad, right? Where she was like, I can't go into the grocery store. And one of the things that I worked on with her is balancing your blood sugar. I'm like, we got to get you enough protein. We have to make sure we don't want you like little snacks all the time. We need whole meals. We need adequate protein, round out the meals, healthy foods. And that helped her tremendously, because a lot of people that deal with anxiety will feel like they need to have a little snack on them, because just in case their blood sugar drops, right? They start to feel anxious. That's that blood sugar dropping. And then once you balance out your blood sugar levels, you're like, wow, I'm more resilient to this, right? I'm more resilient to the little dips and the little highs that my body kind of encounters. So yeah, I can take the conversation in many different ways, but those are like some of the first things that come to mind for me.
I mean, this is a very deep topic, so we're definitely not going to cover all of the ways, but I just feel like this offers so much food for thought, no pun intended. I think back to even my own experience of adjusting my diet slightly, where I was eating more protein, more fats, maybe fewer carbs with every meal, and just noticing how the drop that I was having wasn't as significant, and the impact that had on my stress levels or my anxiety. Or, for example, choosing to, at this point, I don't drink any caffeine, but I used to drink coffee on an empty stomach, and I had like insane levels of anxiety. And then the
Mm.
choice to just eat first before consuming caffeine, like what a difference that made on my anxiety and my jitteriness. I think that it's actually quite empowering for people who are listening to this, because these are all shifts and changes that we can make. I identified as a very anxious person, and through making changes to my diet, quite a bit actually, it made a bigger impact even than I would say some of the mindset work that I've been doing. And I think that a lot of people don't even realize that is possible.
Yeah, I mean, if we can loop both of these things in, like the mindset, nervous system support, and the nutrition, it can be a pretty powerful combo. And I will speak to some therapists sometimes, because I'm like, we need to overlap the work, right? Because if you're working with a therapist, for example, on feeling anxious or depressed, which is of course can be so valuable, but if you're not balancing your blood sugar, if you have a ton of nutrient deficiencies, if you have all this inflammation stemming from the gut, it's like we're kind of like fighting an uphill battle. Like you're fighting your body. Let's get your body to work and be a bit more at like equilibrium. And then it's like that mindset work or the therapy or whatever it might be can really like, I think it can land better in like a more regulated body. So I hope one day it's all overlapped.
It's getting there. I
Mhm.
want to go back to something you talked about earlier, the elevated histamine response, or like the histamine overload.
Yeah.
I've experienced this
Mhm.
actually. I suffer from eczema, and sometimes if it will get out of control, and it's actually usually triggered by stress, and then also like a poor diet, and then it can kind of get out of control. But I remember a couple of years ago I had an episode of a full body eczema flare, and I started to become allergic to the strangest things. Like garlic was on the list, because I ended up doing like an IgH test, I believe, like where we were actually testing for any food sensitivities. And when I removed garlic out of my diet for about 3 to 6 months, I was able to reduce my flares to a point where I could treat the eczema with UVB therapy. But I just remember being so shocked to realize that out of nowhere, because my immune system was so elevated, that I was having a reaction to a very common food group, right? And so I'm curious, what exactly is histamine overload?
Yeah, when I'm hearing your story, I'm thinking with garlic specifically. So, with food sensitivity testing, it's probably an IgG blood test. And we don't really utilize food sensitivity testing, honestly, because food sensitivities I really consider like a result of something else. So, in the case of garlic, typically, and I could be wrong, I mean, you could be like your own case, and everyone's a little different, right? But most commonly when we're seeing someone respond to like garlic and onions, it's a bacteria thing. These are really high in fermentable carbohydrates or FODMAPs. So a lot of people will throw out like the low FODMAP diet or FODMAPs. They're really just fermentable carbohydrates that feed your good gut bugs. They feed your bacteria. So if you have an overgrowth of gut bacteria, already, it can cause a lot of bloating or gas or flares if you're eating these foods. Now, these foods are inherently pretty healthy, right? We know like garlic and onions have so many great properties. I like to dig deeper and understand what's going on in the gut that's kind of causing the reaction to that. So there could always be like a little more to investigate there, but stress can trigger things too, for sure. So when it comes to histamine, I mean, it's really like an immune, like chemical messenger, but it'll also impact and act as like a how can I phrase this properly? Like a neurotransmitter, like it will impact your brain as well. It's not just an immune chemical messenger. We are getting exposure to histamines all the time. They're in our environment. Pollen is outside. Tons of healthy foods contain histamine, avocado and spinach and fermented foods specifically. So it's not that it's bad. Usually the body can break it down efficiently and then we're good, right? Because we can't really stop all exposure. The body produces certain enzymes to help break down histamine. So things like DAO enzyme is like the main one that the body produces to break it down. Now, when we have an overload situation, essentially what's happening is we're producing more than we can break down. So the question is, do we have an issue breaking it down, or are we producing so much that we can't break it down efficiently? And that's why I use I think metaphor, right? Or analogy. I always mix them up, whatever you want to call it, as like the bucket, right? So think of it as like a bucket and the histamine's going in the bucket. And then if there aren't like holes at the bottom of it, those enzymes helping to like drain the bucket, then it's just going to overflow. And that's when we're going to get super symptomatic. We take a real root cause approach to this. So when we dig deeper into histamine overload, it's very often gut bacteria that are overproducing. Like we have histamine producing gut bacteria. It's pretty consistent with like small intestinal bacterial overgrowth. So these bacteria are basically like giving off histamine. And then your body is like, I can't keep up with this. So that's when you'll get the flares. Other things too, like fungal overgrowth, candida can be a histamine liberator. So it can get a bit more like complex, but you can kind of put it in the bucket of we've got microbial issues. The other thing is that DAO enzyme is really produced in our gut lining. So any issues with the gut barrier, the gut lining, the body's going to struggle to kind of keep up with like clearing that histamine. It's not all allergies, but if you feel like you already have a lot of stuff and then you're like, oh gosh, it's allergy season, I literally can't do this. We probably have a histamine thing, a deeper histamine thing going on. The liver plays a role too. And then I'm glad I'm remembering this. I'm like, there's something else. Estrogen, like high estrogen levels. So estrogen and histamine will really play with each other. So typical of someone that has a histamine overload picture is, and it's not everyone, but we go looking for this, is they'll feel worse at ovulation. So ovulation is kind of that midpoint in the cycle where you're supposed to feel good, right? You're supposed
Ding,
to
ding, ding. I would get eczema during ovulation.
Yes.
Ovulation and then right before my period
Yep,
again.
exactly. That's
Yep.
exactly the pattern. Yeah. So essentially, like when you ovulate, estrogen it's going up to its highest point, right? So it's like you menstruate and there's not no hormones, but your hormones are plummeting, right? And then it's like slowly building up in the follicular phase. And then when you ovulate, it's at its highest point and then it drops down. And then, but it can bump up a little bit right before we menstruate, but also like histamine can bump up during that time because histamine also helps to get the uterine lining. Like it can help like with the contraction of the uterine lining that helps you shed the lining, which then becomes your period, right? That's a very common pattern that we'll see. So when estrogen goes up, histamine will kind of go up with it. So that's a clear cut sign that if you're feeling worse around ovulation, then there might be some estrogen dominance going on. And we've got tons of tools for that. So we can help with that. And that could be really revving up that like histamine overload picture. So it can be confusing because like when you ovulate, you're supposed to feel great. You're supposed to feel like your sex drive's higher and like I just say you feel juicier, you have like more energy, right? So when you don't feel that way, you're like, what the heck's going on? Usually there's a histamine thing at play.
Okay, this is really insightful. I want to talk about this scenario of high estrogen, low progesterone too, right? Like
Yeah.
those two are connected, but let's actually start with high estrogen. What do you see as the root cause of that? Is that also related to a microbiome issue? Is it something else? And also, I guess maybe I would want to split this up into what is causing the high estrogen versus is it only because it's not being detoxed or is there actually like an excess being produced? What are your thoughts on?
Yeah, it's a very good question. And I have many answers. I have many answers to this question. So typically it can be a detox issue, right? So we should have some estrogen, that's for sure. It can be a detox issue and it can also be a gut microbiome issue. Let's see how I can break this down. Essentially, estrogen detoxification, phase 1 and phase 2 happen in the liver. So any issues with the liver, like whenever we're helping someone with really painful periods or that leans higher estrogen, like it's a lot of liver work. Now, when we reverse engineer that, it's what's impacting the liver. We're like inundated with toxins left and right. So like a large variety of toxins, women typically get a higher exposure to these chemicals and endocrine disruptors as well through like personal care products, perfumes, skincare, hair care. I mean, all of the fun stuff that we're using, like whether it's makeup or it's like highlights or whatever, nails. I mean, all of that stuff. And then we love candles and they smell good. Men don't use a lot of this stuff. Now, that's of course an overgeneralization, but usually women get more exposure. Then there's like chemicals and like tampons and stuff. I mean, it's just everywhere. So that can obviously feel very overwhelming. So I'm just like, start where you can. Biggest things, where's your biggest exposure? Water, like filter your water. You're drinking water all day, every day. That's like a non-negotiable for me. And I'm happy to share more tips if you want. And then we also have this kind of big rise in women taking birth control. And I think it's like a sensitive topic and it's a very personal choice. I'm not here to knock anyone regardless of their choice to take it or not take it, honestly. But essentially what a lot of birth controls are doing is they're like stopping ovulation, and that's why they're super effective at preventing pregnancy. But when we ovulate is when we produce progesterone. So when we stop ovulation, we won't be producing adequate progesterone, and that will lead to a ton of different issues. And the progestin that's in some hormonal birth controls is not the same as progesterone. So that can cause issues as well. And so I think it's like a combination of like toxin exposure, lots of birth control use, and then the microbiome element of it too. So we have something that's called the estrobolome, which is literally the word estrogen and microbiome put together, estrobolome, right? So this is like the community of gut bacteria that help to regulate circulating estrogen levels. So phase 1 and phase 2 of estrogen detox occur in the liver, and then phase 3 is in the gut. So if you're not moving the bowels regularly, if you have a lot of bacterial overgrowth, that can essentially contribute to you leaning more high estrogen, even if like your blood labs, like you go to your doctor and your hormone blood work looks fine, right? But you're like, I'm having all these symptoms. It could be stemming from the gut. So we will see people with hormone issues, and we like can run functional hormone panels, and there's so much great testing that we can use. But before we even do that, I'm like, let's start at the gut. Like before you invest $400 in this other panel, let's see what we can do here by like supporting liver, adrenals, detoxification, and gut, and then see how you feel. And then we can retest, or we can test after that. So to answer your question, I think it's like a combination of all of these things, like more toxin exposure, endocrine disruptors like everywhere, left and right, and then gut issues. And then I think also a lot of women lean lower progesterone and higher estrogen. Our hormones are never perfectly balanced. They're kind of doing this little dance with each other. So if you have lower progesterone, that can also like make your estrogen look higher. Your estrogen's high relatively, right? So relative to progesterone, the estrogen is high. So then we have to ask, why are women low progesterone? Chronic stress, under eating, over exercising, that kind of stuff.
It's wild to think about how much of an impact our lifestyle has on our hormones. I
Yeah.
mean, one could argue that the way that we've designed our lives is just completely incongruent with helping to balance
I
female hormones. I
know.
mean, just constant stimulation, constant stress, and we're out there trying to balance the scales and have like women present in the workplace and like
Yeah.
doing great things, but the way that we're asking them to get there is like extremely taxing on their bodies. I think, yeah, that's such an important point. Okay, I have to ask you, probiotics. How
Mhm.
do you feel about them? You talked about microbiome a lot, but I'm going to go out on a limb and say that not all probiotics are equal, and
Mhm.
taking your probiotic pill is not the solution. Can you give us a little bit of history and background into the world of microbiome and how we should really be thinking about cultivating a healthy microbiome? There must be a lot of misconceptions around that.
Absolutely. Yeah. To be honest, I mean, the scientific literature with probiotics is quite varied. Like some people are like, these are really not worth it. And some people are like, these are awesome. As a practitioner in this space, we'll utilize them for certain things. We always run lab work. So we want to kind of see what's going on in your gut. You're spot on with saying that not all probiotics are created equal. And even if it's like a quote unquote really good probiotic, it may not be what you need right now. So that's where it can just get also more confusing. So for example, someone with small intestinal bacterial overgrowth or someone with fungal overgrowth in the gut, they may have a really bad response and reaction to probiotics. Maybe it's like these super popular probiotics that we see that have a lot of research and everyone talks about them and they're great and they really help some people, but they just may not be what you need right now. So it can be a little hit or miss. We honestly don't bring them in first like line of defense or first like phase of our work with clients. We tend to kind of bring them in at the end after we've cleaned up the gut microbiome a bit. People will have varying kind of opinions on that. People practice differently, but overall, I mean, a lot of people have bacterial overgrowth. So adding more bacteria can kind of trigger them. Sometimes it can be helpful because your gut's like this ecosystem. So it can help kind of like weed out the bad guys if you have a lot of the good guys. However, that's kind of what like we understand conceptually, but that's not what we see with clients. What we see with clients is we bring them in too early. They don't feel very good. We bring them in at the end. They feel better after we've kind of cleaned it up. The other thing to note is that probiotics are really just bacterial strains, right? That have been shown to be helpful kind of depending on what the strain is. And they all have like different jobs really. Some will be helpful for gut motility. Some will be helpful for diarrhea. So no probiotic is like exactly the same, right? We're looking at different strains. We're looking at different amounts. And then they're also transient, most of them. So what we see is like you take the probiotic and it influences your gut and it can influence your immune system as you're actively taking it. And then you poop it out, really. They're not really the most powerful tool for re-inoculating the gut microbiome or supporting the growth of the good gut bacteria. I really like to emphasize like prebiotics and things like polyphenol rich foods to really help to grow the gut bacteria. We want you to have a lot of like an abundant amount of your good gut bacteria because they play so many roles for us. They help us like synthesize vitamins. They help us convert thyroid hormone. They help with estrogen detoxification. They help maintain a healthy gut barrier. There's a million jobs that these things do. So we definitely want enough of the good ones. And I see really adding in prebiotics, which is more so the food for these bacteria, is going to be more supportive for what we'd say supporting gut proliferation or just the growth of the gut microbiome. So prebiotic rich foods and then polyphenol rich foods. So prebiotic rich foods would be like garlic and onions, right? That's why people with overgrowth won't tolerate them very well. You'll see small amounts in lots of different fruits and veggies, but we can bring in a bit more strategy there. I love jicama. You can do like dandelion greens. You can do gosh, what are some other ones? They're a bit more obscure, but overall, like things that you're like, I'm not eating those all the time. So that's also, I think, what can get some people in some trouble. But I think if you're just taking the approach of adding in a lot of variety into your diet, a lot of different plant foods and plant fibers, you're probably going to be pretty well off. Polyphenol rich foods are things most of us are like probably eating more of. So when you think of polyphenol rich foods, I always shout out a woman on my team because she gave me this term, and it's like you want to think of foods that stain, foods that you would put on your cutting board that like you're like, oh gosh, my cutting board is like red right now, my cutting board's a mess. So like raspberries, beets, like these foods that really leave a mark. They're very high in polyphenol content. Turmeric, right? It's like all over your hands, that kind of thing. And polyphenols are also great for basically supporting these like gut bacteria colonies, and they help your body then produce short chain fatty acids, and which those are really supportive of the gut barrier and then play like a million different jobs. So long story short, prebiotics and polyphenols are what you want to focus on. I'd say even more than probiotics.
This might be a very detailed question, but when you talk about inoculation, which is like actually bringing in the gut bacteria, is that something that these foods that you talk about, they just foster the growth of this bacteria? Do you need them there in the first place? I'm kind of thinking about people who, let's say, have had a lot of antibiotics.
Mm-hmm.
Like, is the gut bacteria like wiped out, or can we think of it more like the gut bacteria has been cut down the way we cut down grass? And if you water it with like polyphenol rich foods and prebiotic rich foods, it'll grow back.
Yeah, it's a very good question. And there's some research that's a little concerning showing that if we take so many antibiotics, then we can see these bacteria go away and not come back. And I don't want to say that because it's just kind of will freak people out, but antibiotics are totally necessary and they can save your life sometimes, right? So I'm not knocking them all, but we do want to be pretty mindful of our antibiotic use because there is some research showing that once they're gone, which concerns me as a human and also as a practitioner for some of our clients. But I would say yes, we can bring in like a good approach would be bringing in, we really like spore based probiotics because they're kind of shown to typically bypass the stomach acid. So actually make it into the colon and large intestine, which is where we want these bacteria like growing and proliferating. And then bringing those in with prebiotic foods, with polyphenol rich foods. I would say that's kind of a more comprehensive approach. We'd really have to test like every strain of your gut bacteria to know what is actually there after what is left after you take an antibiotic. And I don't even think we have that ability yet. So it is a nuanced question. It's a great question. I would say we'll see clients get significantly better after an antibiotic when we just support the regrowth with targeted spore-based probiotics and then also prebiotics and polyphenol-rich foods. And then also supporting like liver function because the antibiotics can do put a little strain on the liver and then the gut barrier too. Things like butyrate, the short chain fatty acid that your gut microbes will actually produce after eating certain foods and polyphenol rich foods. So you can bring in certain supplements and then you can also kind of help your body, like your gut do it on its own. But it's a good question. I think in a lot of cases, it's more like cutting the grass down. But I think there are some cases where they're gone and then we have a hard time getting them back.
Okay. And I just want to go back to one other question based on something you said before, which is you talk about cleaning up the gut microbiome, right? That when you start working with clients, you clean that up. What does that mean exactly? Is it just feeding the microbiome with good foods? Is it actually removing some of the microbiome that you don't want there?
Yeah, it's a great question. So we run a lot of functional stool testing. We run a functional stool test on every single client that works with us, and that's how we're going to see kind of what is going on in their gut. Like I said earlier, it's not going to check every single strain of microorganism that you have. Like we've got trillions, and I don't think a test exists that would check every single strain. I don't even know if we know every strain. But it's looking for ones that kind of cause more issues that research shows have caused more issues. So we're checking for things like Pseudomonas, we're checking for things like Morganella, Klebsiella, some of these things that will cause more like health issues in people. And when we see, for example, like a higher level of those, we can bring in strategies to bring those levels down. So that can be like certain herbals, like herbal antimicrobials. What is great with the testing that we run too is it also checks for like digestive capacity, or are you breaking down your food very well? Because if you're not, then those bacteria are going to start to overgrow, right? So think of it as like a pond versus like a river. So a pond, you'll get that like film on top of it where the bacteria is growing because nothing's moving. It's just still. Now a river doesn't grow as much of that bacteria because the water is like always rushing down. That water rushing down is like your digestive juices, right? Your stomach acid, your bile, your enzyme secretion, all of those things are helping to move things through the GI tract, support that gut motility, break down the food, and then we package it all up and we poop it out. But if that's sluggish, then bacteria are gonna like undigested food particles will be sitting in the GI tract longer. Those will be feeding the gut bacteria, and then we can get that overgrowth picture. It's really bringing all of this into account, right? Not just like getting rid of some of these bacteria or supporting the good ones. It's what is going on in your body. And that's where like the customization I think can be very helpful versus I'm just going to try this probiotic that has a bunch of strains in it and see what it does. It's what's going on in your body right now. And then we can just tailor it a bit more. So some of it's going to be cleaning up or like getting rid of these overgrown bacteria or infections. Like we'll see parasitic infections, we'll see Helicobacter pylori infections, fungal overgrowth, different than a bacteria, but that will cause tons and tons of symptoms for people. And then we can bring in herbals and other things to biofilm disruptors and all of that to get rid of these levels of higher microbes. And that will help people feel so, so much better.
Oh my gosh, I could keep chatting with you forever, Hannah, seriously. But we are actually running up on time. I feel like we touched on some of the hormone stuff, but this was like even better overview than I could have imagined, kind of diving into how to really think about our digestion and our microbiome. And I feel like it really provided at least me so many insights into how to think about our gut health differently, not just from the north to south perspective, as you so eloquently said, but also really understanding our gut microbiome differently. Because as somebody who for years had been taking a probiotic, I actually stopped like 6 months ago, mostly because I was thinking, like, I'm just taking these strains, like continuously taking the same strain
Yep.
every single day. Is that what I'm meant to be doing? Like, I'm sure that everyone's gut bacteria composition looks so different. And so, what am I changing by just continuously taking this one strain? And I actually feel pretty good after doing that. So, I feel like this has been just such an eye-opening conversation. If you could just share with people, where can people find you? I'll hyperlink everything below, but I know you have an amazing podcast, so they can dive deeper into every single individual topic there.
Yes, we do. It's newer. So thank you. I'm so glad this was helpful. Yeah, I love chatting about this stuff, so I could just go on and on, but we'll wrap it up. So the podcast is a great place to learn more because I do like pretty deep dives. I mean, if you want to like really learn and nerd out, come to the podcast because I break down histamine, I break down SIBO, I break down all of these different things. And it's called the Nutrient Dense Podcast. And you can also find me on Instagram at Hannah Aylward HHC. I'm pretty active there. We make a lot of posts. I do like weekly Q&As with my audience pretty regularly. So that's a good place. And yeah, don't hesitate to come on over and say hi. And then our website, if you're interested in working with us or getting more kind of customized support, it's just hannahaylward.com.
Amazing. And you'll find all that in the show notes. Hannah, thank you so much for jumping on today.
Yes, thanks so much for having me. It was fun.
Thank you so much for tuning into The Other Way. If you enjoyed this episode, please leave a 5-star review. It really helps the podcast grow, and I'm ever so grateful. If you want to stay connected, you can find information on how in our show notes. And finally, if you're curious about inflow and want free resources around cyclical living or moon cycles, check out inflowplanner.com. And of course, for all my listeners, you can use the code podcast10 for 10% off any purchase. All right, that's all for today. See you next time.